Have you ever experienced pain or discomfort in your jaw? Maybe clicking or popping sounds when you chew? You might be dealing with TMJ disorder, a condition affecting the temporomandibular joint. This joint allows us to talk, chew, and yawn. When it's not functioning properly, it can lead to a range of symptoms. Jaw pain is the most common symptom, often worsening with chewing or talking. The pain can radiate beyond the jaw, causing headaches, especially in the temples or behind the eyes. Many people also experience earaches or a feeling of fullness in the ears. The discomfort can extend to the neck and shoulders, leading to muscle tension and stiffness. Living with TMJ disorder can impact your daily life, making it difficult to eat, sleep, and concentrate. Several factors can contribute to the development of TMJ disorder, often acting in combination to create stress and strain on the jaw joint. Stress is a major culprit, leading to jaw clenching and teeth grinding, especially during sleep. This unconscious habit puts excessive pressure on the TMJ, leading to inflammation and pain. Teeth grinding, also known as bruxism, can occur independently of stress, often stemming from dental misalignment, missing teeth, or an improper bite. The constant grinding wears down tooth enamel and puts tremendous pressure on the TMJ, leading to pain, clicking, and popping. Injuries to the jaw, such as those sustained in a car accident or sports injury, can also damage the TMJ or the surrounding muscles and ligaments, contributing to TMJ disorder. Poor posture, particularly forward head posture, is another common contributor to TMJ pain. When your head juts forward, it puts strain on the muscles in your neck, shoulders, and jaw, leading to muscle imbalances and pain. Addressing these underlying causes is crucial in effectively treating TMJ disorder and preventing its recurrence. Acupuncture, an ancient Chinese practice, has gained increasing popularity as a natural treatment for TMJ disorder. This technique involves inserting thin needles into specific points on the body to stimulate energy flow and promote healing. While it may sound intimidating, acupuncture is generally painless, and many people find it deeply relaxing. Acupuncture is believed to work by relaxing the muscles surrounding the jaw, reducing tension and spasms that contribute to TMJ pain. It also improves blood circulation to the area, bringing in oxygen and nutrients to promote healing and reduce inflammation. Additionally, acupuncture stimulates the release of endorphins, the body's natural pain relievers, providing further pain relief. Numerous studies have demonstrated the effectiveness of acupuncture in relieving TMJ pain. A study published in the Journal of Orofacial Pain found that acupuncture significantly reduced pain intensity and improved jaw function in patients with TMJ disorder. Another study in the Journal of the American Dental Association showed that acupuncture was as effective as conventional treatment with a mouthguard in reducing pain and improving jaw mobility. Active release techniques, ART, hands-on relief for TMJ. ART is a hands-on therapy that releases adhesions in muscles, tendons, and ligaments. These adhesions can restrict movement and cause pain, contributing to TMJ disorder. Practitioners use their hands to break up adhesions, restoring normal movement. They apply pressure while guiding the patient through movements. This helps reduce muscle tension and improve range of motion. ART is effective for TMJ disorder. Studies show ART significantly reduces pain and improves jaw function. Section 5. Dry needling, targeting trigger points for lasting relief. Dry needling involves inserting thin needles into trigger points, which are tight, sensitive knots in muscles causing pain. Trigger points in the jaw muscles can contribute to TMJ pain and headaches. Dry needling aims to release these points, alleviate pain, and restore muscle function. It creates a small lesion, stimulating a healing response. This increases blood flow, reduces inflammation, and releases tension, often used with other therapies like acupuncture or RT for comprehensive relief. Studies show dry needling effectively treats TMJ disorder. A study found it significantly reduces pain and improves jaw function. Section 6. A holistic approach to conquering TMJ pain. TMJ disorder is often a complex condition with multiple contributing factors. Therefore, a holistic approach that addresses all aspects of the problem is crucial for long-term relief. This may involve a combination of therapies including acupuncture, ART, dry needling, massage therapy, physical therapy, stress management techniques, and lifestyle modifications. A qualified healthcare professional can assess your individual needs and develop a personalized treatment plan to address the root causes of your TMJ pain. This may involve addressing postural imbalances, correcting dental issues, reducing stress, and improving jaw mechanics. Remember, you don't have to suffer in silence. By seeking professional help and exploring natural treatment options like acupuncture, art, and dry needling, you can find lasting relief from TMJ pain and improve your overall quality of life. Michael Woodworth has been transforming the lives of patients suffering from TMJ, migraines, and cervical neck pain for over 20 years. His unique blend of orthopedic acupuncture, dry needling, and active release techniques, ART, delivers results that are hard to find elsewhere. If you're ready to experience lasting relief and improve your quality of life, visit Makari Wellness in San Diego or Oceanside, California. Schedule today and take the first step toward a pain-free future.